Good morning. All right. Welcome to the 2023 Movement is Life National Summit, Bridging the Health Equity Gap in Vulnerable Communities. My name is Mary O'Connor. I'm honored to chair the board of directors of Movement is Life, and we're just delighted to have you all with us today because this is such important work that we're all doing and committed to. So I want to start with kind of an overview of the theme of bridging the health equity gap in vulnerable communities. And there's information in your summit guide on this, and basically some resources, additional resources that you can use the QR code to access, looking at, we know our gaps: access to care, nutrition, access to movement and information, and of course, access to opportunity. So that is our theme, bridging the health equity gap in vulnerable communities. And I'll just take a moment for those of you that are not as familiar with us. Movement is Life is a national, nonprofit, multidisciplinary coalition. We seek to eliminate racial, ethnic, gender, and geographic disparities in muscle and joint health by promoting physical mobility to improve quality of life among women, African Americans, Hispanics, and those living in rural communities. I know that was a little long, but it really encompasses what we're about. And right now, I'd like to share with you a short video that we've made, updated from a prior version, that I think will really give you a good sense of who we are and what we're about. The vicious cycle is something that impacts every single one of us, regardless of whether we're a man or a woman or African American, Hispanic, Latino, Caucasian. It impacts every single one of us because movement is so essential to our health. When we look at the medical vicious cycle, we start with joint pain. And joint pain is so common, especially among adults. And so when we get joint pain, particularly knee pain, we stop moving. We decrease our level of physical activity, but we eat the same, so we gain weight. And that added weight puts more pressure on the joint, increasing the pain, further lowering our level of activity, driving more obesity. And so we're in this vicious cycle.
My knees they hurt, arthritic, because of the gain of weight. It's really come on like gangbusters. This is the heaviest I've been in my entire life, and I'm not liking it. It's very problematic. You find that there are things that you thought you were able to do before, they become a chore to do now.
I was weighing to 67 pounds, and I started with pain. I got pain in my legs. I got a lot of pain in my knees and in my hips. They treat me with some kind of chat in my back. That's helped me a lot, and I have been with medication for that pain.
According to the National Institute of Health, 39.6% of U.S. adults are obese. African American women have the highest rate of obesity, with 4 out of 5 women being overweight or obese. Among Hispanic American women, 78.8% are overweight or obese, compared to just 64% of non-Hispanic white women. For every 10 pounds of overweight, that's 60 pounds of added pressure on your knees.
In my community, 53% of the people in my community are overweight. 93% have type 2 diabetes. They're dying from diabetes, obesity, heart disease, arthritis, and it's the norm, and we kind of accept it.
So with my obese patients, as a primary care physician, I see a ton of other comorbidities. They'll have hypertension, they'll have diabetes, they'll have joint pain, especially the knees, more pressure on the knees. More pressure on the knees mean I'm still gonna be immobile. Now I can't move around as much as I'd like to, so now I'm gonna gain more weight. So you just sort of get into this vicious cycle. Now, if you factor in the other comorbidities like heart disease, diabetes, mental health issues like depression, because now you're depressed because you're obese, you're not moving around, you're gaining more weight. You factor all those things in, and this is what we call this vicious cycle.
My mom died in October, and my weight was at 260 and increasing. Food had become my comforter, my friend, my be-all, but the end result of that was that I found myself in this endless cycle where my weight continued to balloon and I couldn't see my way out.
So if you really want to start living, you need to start moving. Being able to move allows us to live our best life. It allows us to do the things that matter to us.
I wanted to attend my daughter's graduation, her high school graduation. And I was so proud of her. Top of her class, she was a valedictorian. It was a dinner that she was to attend. And she could bring, someone with her. She really wanted me to be there. Excuse me. But, I couldn't make it. Because of my weight, I felt, what am I going to wear? Or when I get there, will I be able to sit, with everybody else? So I missed that. My daughter now, she's a sophomore in college. I want to be there when she graduates.
So when you can't move the way you want to do, it affects everything because it affects things that make you happy. So being able to go see family members, being able to go to work, being able to go to your church, being able to visit grandchildren and things. Just so I counsel my patients to start with the small things. We find one or two small actionable steps that we can take. We start with possibly, hey, can you park a little bit further from the grocery store? Or can you walk a half a block around the house, around the block before you go home? One small step forward really can lead to huge changes in your overall health.
Wyoming has 65% are overweight and obese, and that's pretty significant. I think obesity is many things. But living in a rural environment where there's long distances between towns and communities, people drive a lot today, so they're not necessarily as active as in the olden days when people walked distances. In our busy society, as women, I think that many times you're taking care of family. You also have a job. You have to prepare meals. And all of that can take a lot of time. And so when you're in a hurry, it's so much easier to maybe go to the drive-up window and get a bucket of Kentucky Fried Chicken for dinner.
Well, I think part of it comes from poverty because, and I found that out for myself, it's very expensive to eat right. It's expensive to eat healthy, to eat fresh vegetables and fresh fruits and things like that. And it's easier when you're on a fixed income, and many people here are on a fixed income, it's easier to eat out of a box. It's easier to eat from a can. And all those things are processed and have all that added sugar and all that added fat and all the added sodium. And so all those things contribute to things like heart attack and stroke and diabetes and cardiovascular issues.
We have many obstacles to breaking the vicious cycle, especially in the Hispanic and Latinx community in South Texas. As an example, many people live in colonias, which are areas where you're living that don't have running water, may not even have electricity, there's poor transportation, and so you don't have parks nearby or any place where you can actually get exercise. And many people work 2, maybe even 3 jobs and live paycheck to paycheck. And when they get home, they just want to eat a quick meal, that may not be very healthy, and they don't want to exercise, they just want to go to sleep.
There are many social determinants that impact communities of color and rural America. But the common thread in these communities that are experiencing health disparities is poverty, lower access to good, high-quality health care, access to healthy foods, safe places for people to walk, exercise, be outside with their families. So all of these factors come into and create this constellation of barriers for people to embrace individual behavior change that will promote their health.
So start moving, start living for my patients and in my practice means you need to keep moving. So my job is to keep them moving so they can live their best lives.
So start moving, start living means to me that you're going to be getting up off the couch one step at a time. But one step at a time moves into maybe a block, maybe 2 blocks.
Movement is the center of life. It is the thing that unifies everything we do. Can you really live a good life or a quality of life if you're not able to move, if you're not able to engage with those you love and do the things you enjoy?
Movement is life. Movement is the way to break that vicious cycle.
Well, I hoped you enjoyed that, and my thanks to everyone who contributed to the making of the video, and of course to, in particular, the individuals that shared their stories with us. You know, I've probably heard the woman from Chicago who couldn't go to her daughter's high school graduation, who was valedictorian several times, and even now it still gets me. So, I mean, we have a lot of work to do to help these vulnerable patients and communities. So, okay. Otherwise, I'll get all emotional and, you know. So, just a note of gratitude. Zimmer Biomet has been our faithful supporter and sponsor. We were actually founded in 2010. We became a nonprofit last year. And so I would ask and encourage all of you to remember us in your charitable contributions, and we'll touch again on that in a moment. So I'm going to go back for a moment to touch on why we have muscle and joint health disparities. And you already saw the medical vicious cycle in the video. There's one other thing I want to point out about this. This medical vicious cycle is an equal opportunity employer. Anyone can get trapped in this medical vicious cycle. The wealthy white male CEO can get trapped, but we know that women, individuals of color, and those in rural communities are more likely to get trapped in this cycle. We know that from the statistics, from the data. And why is that? Because around this medical vicious cycle, you see the blue ring of social determinants of health, which we touched on in the video, and we will talk about extensively today and tomorrow. But then surrounding that is the ring of policy, because how we create both public and private policy influences the social determinants, which then of course influences the medical vicious cycle. So we created this framework at Movement is Life, and I love it because it really helps people understand how all of these factors are interconnected in driving the health inequities that we shamefully have. Now, the impact of these discrepancies, these disparities, are significant. Here, this information is also in your summit guide. So if you just look at these 3 communities and the average life expectancy, you can see in more affluent Bethesda, Maryland, 85 years old. In the predominantly African-American community of Anacostia, 65, and in rural Hazard, Kentucky, 73. And when we overlay that with median household income, you see the highest income in Bethesda, and then Anacostia and Hazard essentially equivalent. I don't know anybody in this room, I don't know how you can live on $26,000 a year. I don't know how they do it. And so this again gets back to how do we provide opportunity for people to have better paying jobs so that people can rise up out of essentially poverty. Now, what have we at MIL been doing to address disparities? We work at multiple levels. One of the projects that we've done this past year is to help educate orthopedic surgeons and their teams on the relationship between preoperative optimization and healthcare disparities. So you saw in that vicious cycle, obesity, diabetes, hypertension, depression, okay? These are the patients that will come into the orthopedic surgeon's office with end-stage knee osteoarthritis, and sometimes, right, the orthopedic surgeon may say, you're not an appropriate surgical candidate because of your medical conditions. And so can we help the purpose of this whole series, we did a whole series of medical conditions and how they can be optimized, diabetes, hypertension, smoking, et cetera, to help encourage surgeons and their teams to be optimizing these patients so that if they're appropriate candidates for surgery from a joint perspective, their joints very arthritic, they have significant functional compromise, that they could actually be candidates for surgery. Now, I'll take a step back. We want to promote them not getting that bad, right? We want them to be more active, lose weight, have better health habits so that they never get to the point where they need joint replacement surgery. But we know some people still will. And so we want them to have opportunity if that's if that's an appropriate operation for them. We continue to work with policymakers, and this is a slide from when some of our team members met with the late, great John Lewis. The legislation that Congressman Lewis had introduced has now been reintroduced by Representatives Sewell and Senator Booker, labeled the John Lewis Equality in Medicare and Medicaid Treatment Act. And what this does is it addresses what I believe was an unintended consequence of an aspect of the Affordable Care Act, which gave CMMI, the Center for Medicare and Medicaid Innovation, the authority to create payment models for hospitals and doctors without congressional oversight if those payment models were comparable or higher in quality and lowered cost. Okay? Now that makes sense, right? We all want to lower healthcare costs without compromising quality. But what that original legislation failed to include was whether these payment model changes would drive increased disparities. And we know that they have. Bundled payment models promote cherry picking of healthy patients, lemon dropping of unhealthy patients. And we know the unhealthy patients are going to be those that are more likely to be in vulnerable communities. So this legislation addresses that gap by mandating that CMMI consider how new payment models will impact health disparities. So we're excited about continuing to work with Representative Sewell and Senator Booker to get this passed, and encourage all of you to be aware of the legislation and encourage your representatives to support it. We continue with Operation Change. We have 6 programs scheduled for 24. This, of course, is our community-based 18-week program for women with knee pain and at least one other comorbidity. Our programs are culturally sensitive, so we have African American groups, Latina groups, rural groups, and the results are honestly very impressive. 18% improvement in mobility, 70% decrease in hopelessness. No drugs, no doctor visits, okay? This is creating a community for these women where they support each other, and we help give them the tools to make the behavior change that's going to drive improvement in their health. So we're very, very proud of that program. Additional highlights, we've advanced our nonprofit infrastructure with Smith Buckland. And Tanya Gomes, you've probably seen her running around. She's our operations director. That's her picture. So if you haven't met her, when you see her, say hi. We have continued with our Incredible Health Disparities podcast. We have 153 episodes now. So I just want to thank everybody that's been involved in the Health Disparities podcast. We have a fundraising partner now, Partners in Philanthropy, that we're very excited about. And we also did a major website overhaul. So before we became the nonprofit, we actually had 3 different websites. And so we spent a lot of time, and with support from some folks at Smith Buckland, to make one beautiful website. This site that you may be familiar with, because it's probably where you register for the summit, is actually a microsite that we put up so that people could register for the summit, we could provide information. And now our new full website, which is movementislifecommunity.org, is up and running, and it's a beautiful thing, and I would encourage you to go preview it and look at all the incredible resources that we have on the website. Okay, so I'm going to briefly touch on the agenda for today and tomorrow. We have had a change for today. Unfortunately, Dr. Geronimus, who was scheduled to speak, became ill and let us know on Tuesday that Tuesday, yes, as in 48 hours ago, that she's unable to attend. And she also was not up for a virtual presentation. So we've made a couple minor adjustments to the agenda. There is a paper printout of the new agenda, which may be at your table or certainly out at the registration desk. So just FYI, that has been updated from what is in your summit guide. We'll start off this morning with Dr. Pedro Joe Greer talking about changing medical education. Then Ariel Belgrave will present on sustaining high performance with self-care. We'll go into our workshops, and we have 4 workshops, which are listed on the slide. There's the workshop session in the morning, then we will have a second workshop session in the afternoon. So you should have hopefully signed up for 2 different workshops, and we have taken the feedback from folks that they had workshops that they wanted to attend and they couldn't, and so we're repeating the workshops now so that you can actually attend 50% of the workshops, and would be anxious to have your feedback on how you think that worked for you. For those of you that have been here in the past, we used to have 4 workshops at that, and then 4 different workshops, 8 workshops total. So we're going to try this and see how it goes. The workshops are amazing, and I think you'll really get a lot out of them. We'll come back here for Dr. David Ansel to talk about addressing the health gap. For those of you that know Dr. Ansel, he's just an amazing leader, friend of Movement is Life, and we're really looking forward to having him back. We'll close with our awards ceremony and reception. On Friday, we have the amazing Bree Jones coming, followed by Dr. Mark Watkins, who is the Chief Medical Officer at Kroger Health, and Kroger Health is doing just unbelievable work in terms of addressing nutritional support, nutritional education. I won't steal his thunder, but you're in for a treat. We have Diana Ramos, who's the Surgeon General in California, talking about cross-collaborative partnerships, an amazing panel on racism in education and healthcare with Jennifer Holmes and Micheline Davis, and then we will close with former Surgeon General Jerome Adams on how do we get to health equity. So we do need your help. On Friday, you will see on the agenda, we do have some time for some roundtable discussions. We're really asking you to come with your ideas. What are new things, new initiatives that we can consider? How can we take existing work and make that more effective and advance it? So we really want you to help us by enriching the conversation, connect us to philanthropic groups or donors that you may be aware of. For all you social media people out there, here's our social media post information for X, formerly Twitter, Instagram, and we're also on LinkedIn. Okay, now I'm going to close with this little Thanksgiving Day epiphany that I had. So I'm stuffing the bird, literally, on Thursday, putting the stuffing in the turkey, and my sister has some holiday music on, and on comes Rudolph the Red-Nosed Reindeer. And I'm listening to Rudolph the Red-Nosed Reindeer, and I say, wow, that's really a DEI song. Rudolph the Red-Nosed Reindeer is about diversity, equity, and inclusion. Little did I know, right? Written in 1939, described as a fantasy story made to order for American children, each child has the need to express and receive approval for his or her individuality and or special qualities, embodies the American dream for the child, right? Rudolph is different. He's funny. The other reindeer make fun of him. They call him names. They don't let him play any reindeer games. But then, all of a sudden, Rudolph's individuality is recognized for the value that it can bring, right? Leading Santa's sleigh through the bad weather. And then Rudolph is the hero. Now, Rudolph may not always be needed to lead the sleigh every year, right? But the fact that he's different doesn't mean that he's not important. And that's why all of a sudden this story came to me. I thought this could be the original diversity, equity, and inclusion story that we've all learned as children. And by the way, that picture of the Golden Rule book I had as a child, I was like, I know that book, I know that cover. So what I'm asking is that as you're here today, let's all channel our inner Rudolph during the summit and beyond. Give us your individual ideas. Each of you have value, have different perspectives, can shine your light, your bright, shiny light on the challenges that we face to help us find solutions. So thank you very much.